So this video is going to be an eye-opener. Have you heard of the word ectopic pregnancy? If you are yet to hear of the word ectopic pregnancy, sit back, relax, and be well informed. And for those of us that have heard of the word ectopic pregnancy, or it has happened to us firsthand, please don't forget to share your experience, and anywhere I might be lacking, do not forget to add your contributions on the comment section. And if you find this video very helpful to you, do not forget to put a thumbs up. And if you are yet to join this family, don't forget to subscribe to our channel, and don't forget to follow us on all our social media platforms. We are at Royal Care Counselling Outreach. So this is your online counselor. My name is Rachel. I am Royal Care Counselling Outreach. So before we continue, let's first define ectopic pregnancy. Meanwhile, let's define ec. Ec means outside, while endo means inside. Ectopic pregnancy is the implantation of fertilized ovary in an area other than the endometrial lining of the uterus. It can also be defined as the implantation of fertilized female eggs outside of the womb or outside of the uterus, meaning when pregnancy occurs outside the endometrial lining of the uterus. Pregnancy, I don't want us to be confused, pregnancy is the implantation of fertilized female eggs in the uterus, in the womb, while ectopic pregnancy is the implantation of fertilized egg or ovary outside of the womb. That is, it is not in the womb, it is outside the uterus. That is what we call ectopic pregnancy. Let's move ahead to the risk factors of ectopic pregnancy. Risk factors are things that predisposes a woman to ectopic pregnancy, things that does not make a woman become pregnant, normal, to have a normal pregnancy. One risk factor is sulfingitis, meaning once the fallopian tube is infected, it affects the L.I. structures. Automatically the L.I. structures becomes altered, causing the egg to implant in the tube instead of implanting in the uterine walls or the womb. The implantation starts at a tube. That's what we call tubal pregnancy, meaning when fertilization is occurring, the egg continues to move. Instead of it to go fertilize or go implant in the womb, it stops at a tube and decides to implant itself. That's what we call sulfingitis. Number 2 risk factor is previous tubal surgery, meaning once the fallopian tube has been affected due to previous surgical procedures. Some surgical procedures like family planning, once you undergo some kind of family planning that has to do with tying or cutting of the fallopian tube, it automatically alters the L.I. structures, which might lead to ectopic pregnancy. So once the L.I. structures are affected, instead of the pregnancy to implant, or the egg, to implant in the uterine walls or the womb, it decides to stop and implant in a tube. Number 3, we have adhesion. Adhesion is the body's way of mounting defense against series of untreated infection or some surgical procedures, meaning those tissues that are being released serve as a state of mounting defense against the body. So in the process, the egg does not implant in the right direction because of the series of untreated infections or some surgical procedures. So the body mounts defense. The body does not recognize the pregnancy, so the body would not allow that pregnancy to fertilize or implant in the right position. So implantation will occur halfway. It will not occur where it ought to occur. To have previous history of ectopic pregnancy, probably the woman has experienced ectopic pregnancy before. It can reoccur. I am not saying it must reoccur or it will reoccur. It can reoccur. That's the statement. It can reoccur. Number 5 is cigarette smoking. For those women that smoke, you're at risk of having ectopic pregnancy because the L.I. structures such as fimbriae and cilia might be affected. However, in a woman's body, L.I. structures are in diverse parts of the body. So once you smoke, you are at risk of having cancer, of having ectopic pregnancy, and other health related issues. So if you know you are smoking, you are at risk of having ectopic pregnancy. Number 6, we have increase in age. As we age, our body's immune system reduces. It's not as strong as it used to be. So as you keep aging, your body's system might not be able to carry the load it can carry while you were younger. So as you age, you're at risk of having ectopic pregnancy, meaning age predisposes one to ectopic pregnancy. The last but not the least I'm going to be talking about, that's why I say if you have other contributions, please don't forget to put your comments below. We have use of intrauterine devices. That is, this use of intrauterine devices, it affects the release of eggs and the transportation of egg into the uterine wall or the ovary, meaning the eggs might not fertilize in where it might not implant itself in where it ought to implant itself. It can stop halfway and decide to implant itself there. So the use of intrauterine devices affects or puts one or predisposes a woman to having ectopic pregnancy. I am going to be talking about the classifications of ectopic pregnancy. However, I'm going to be listing them. I am not going to be explaining them in details because I am not an anatomy and it's not in my field. So once you observe that you are having ectopic pregnancy or you are faced with ectopic pregnancy, quickly dash out to your medical personnel for immediate help. So the classification of ectopic pregnancy. Number 1 is tubal. Tubal pregnancy is one of the most common pregnancy. It happens to about 97% of patients. So it is one of the most common one. Then number 2, we have cervical. Number 3, we have ovarian. Number 4, we have intraligamentous. Number 5, abdominal. All this happens around the stomach area that ectopic pregnancy can occur. So we are going to be talking of symptoms of ectopic pregnancy. That is when you see these symptoms in occurrence when you are pregnant. Please dash out, go on kitty, and go and meet your medical practitioner. So number 1 of the symptom is pain. When you see pain occurring around your abdominal axis or your pelvic axis, 100% of ectopic pregnancy patients experience this. So once that pain is around your pelvic and your abdomen, please go and see your health worker, because once you are pregnant, I see no reason why you should be experiencing that kind of pain when you are not in labor. Please go for a good ultrasound or see your medical practitioner. Bleeding through the vagina. 75% of ectopic pregnancy patients experience this. So once you notice that you are bleeding through the vagina, that is a risk factor. However, some people see it or perceive it as spotting because it's usually light. But once you are pregnant and you are seeing or you are perceiving something that looks like spotting, you're bleeding through the vagina, please go for urgent medical attention to be sure your egg is fertilizing or is being implanted in the correct place or in the womb. Number 3, we have amenorrhea, meaning there's no sign of menses and there's no sign of pregnancy. You are not seeing your period and you are not seeing sign that you are pregnant. Please dash out to your health worker, please, instantly, to be sure of what is occurring in your system. And the next one is fainting, where you are constantly fainting because you are pregnant. You feel, and yes, it's part of pregnancy, you keep fainting. 33 to 50% of ectopic pregnancy patients experience this fainting. So if you observe that you are always fainting when you are pregnant, please go see your health worker, because you might be bleeding internally without knowing. And as you keep bleeding internally, someday you are going to shut down. because nobody is seeing you bleed, but internally you are bleeding. Number 5, which is nausea and vomiting. When you are always nauseating, normal pregnant women or some pregnant women always vomit or nauseate during their pregnancy. But if you are the type that I've observed that you don't feel like that, you don't vomit, you don't nauseate during your pregnancy, and all of a sudden this particular pregnancy is weighing you down, you are vomiting constantly, you are a unique few that don't vomit or nauseate in your previous pregnancy, but this time around you are experiencing it back to back, please see your health worker to be sure that implantation is occurring in the right axis. Next, we have diarrhea. When the pregnancy starts to grow, starts to increase, starts to develop, it affects the intestine, causing the person to constantly go to the toilet. It leads to diarrhea because the pregnancy is, of course, increasing. So it's making the intestine not to be comfortable. That's why the person is always visiting the toilet. So once you observe that you're always regularly or occasionally running to the toilet, please see your health worker. We also have jaundice. That's yellow eyes. When you are pregnant and you are having yellow eyes, it's a sign of hemolysis, and it should be taken seriously. It should not be taken with levity. Please, when you are pregnant and you notice you are having yellow eyes, it's a sign of hemolysis. Please take it seriously. See your health worker. So I want us to take note of this. Ectopic pregnancy rupturing is an emergency and should be taken very seriously, because once an ectopic pregnancy ruptures, it is life-threatening and it can shut the person down, meaning it can lead to death within 30 minutes. So once you notice you have ectopic pregnancy in your body, growing in you, please go for medical attention immediately so that it doesn't rupture. Once it ruptures, it is life-threatening, and within 30 minutes you might be gone. Let's discuss about the investigation of ectopic pregnancy. Investigation meaning things that doctors will ask you to do as a pregnant woman to be sure you have or do not have ectopic pregnancy. However, we have abdominal ultrasound. That is to detect where the pregnancy is growing. This abdominal ultrasound will help the doctors or medical practitioners to determine if the pregnancy is being implanted in the right direction or it is growing in the tube. Number 2 is pregnancy test to confirm if the person is actually pregnant. You can't have ectopic pregnancy if you are not pregnant. Number 3, we have laparoscopy. That's the golden standard to diagnose ectopic pregnancy. So those are the investigations of ectopic pregnancy. Now let's talk about the treatment of ectopic pregnancy. Number 1 treatment of ectopic pregnancy is expectant. Expectant in the sense that the person is being kept under watch by the medical doctor. However, ectopic pregnancy is being removed so that it doesn't rupture and becomes life-threatening to the person. But once it's a case of expectant, that the person is being kept in the hospital for observation, meaning the person is having a unique baby. I'm not saying that other ectopic pregnancy, their babies are not unique. Unique baby in the sense that probably this person has been looking for a child for donkey years, and eventually this person is able to get pregnant, and unfortunately it becomes ectopic pregnancy. The person is being kept under watch so that it doesn't rupture or burst while the person is at home. So the person is being kept under watch in the hospital. Number 2 of the treatment is medication. Medication in the sense that they can give the person some medications to help the person. The last but not the least of the treatment of ectopic pregnancy is surgery. Surgical procedures can be carried out to prevent ectopic rupturing. Like I said before, ectopic rupturing is a very serious emergency issue which shouldn't be taken lightly, because it is life-threatening and can shut an individual down before or within an hour. Please, if you notice or if you are being told you have ectopic pregnancy, please take it serious. And however, if any of your person or your ward or your relative is faced with ectopic pregnancy, please encourage the person to go for medical checkup. However, the person might be having that mental imbalance of losing a child, or having the problem that how can I psychologically balance that this child, I'm about to lose this child because it's not fertilizing or it's not being implanted in the right direction. Please refer the person to a counselor. And of course, the counselor is never going to take a chance. The counselor is going to place a referral service for medical attention, while the person's mental stability will be worked on by the therapist. I still remain your online counselor. If you are yet to subscribe, please do not forget to subscribe to this channel. Follow us on all our social media channels at Care Counselling Outreach. Bye bye.